As the number of COVID-19 cases continues to rise globally and right here in Guyana, we encourage everyone to practice social distancing and wash your hands thoroughly and frequently as we strive to stop the spread of the virus. Welcome to InfoHub for Tuesday, April 14. Thanks for joining us. President David Granger has assured that Guyana is becoming better prepared to tackle the novel coronavirus, even as he lauded local frontline workers in the fight. Alexis Rodney has our first story.
The head of state noted that while the country has embarked on a path of public health, there remain challenges ahead before the disease is defeated. Latest reports indicate that 47 Guyanese have tested positive for COVID-19, of which 6 have died. From that amount, 8 have also recovered. President Granger said he is pleased with the recoveries and expressed hope that the other cases will also recover soon. In the meantime, he noted that the government is becoming better equipped to provide proper personal protective equipment for the medical staff carrying out testing and treatment, along with materials and equipment such as beds, respirators, and ventilators for those who become critically afflicted. He said the capacity for infrastructural and institutional accommodation is also being expanded. Quote, "The effort to fight this disease requires unprecedented expenditure and outlay of resources to enable identification and testing, isolation, protection, and treatment," unquote. The head of state also lauded the selfless services of all public health practitioners who are on the front line, protecting those stricken by the disease. Quote, "They have been working tirelessly through this very difficult situation to provide quality health care to those who have been infected and afflicted. Everyone in the public health system has played a vital part in the fight against this disease," unquote. For InfoHub, Alexis Rodney.
Meantime, Prime Minister and Chairman of the National COVID-19 Task Force, the Honorable Moses Nagamutu, has informed that Guyana's requests to international agencies for assistance to combat COVID-19 are currently pending.
At the last COVID-19 virtual media conference, Prime Minister Moses Nagamutu indicated that several requests have been made by Guyana.
The Minister of Finance has reported to us that he has approached a number of institutions, and some of these institutions are in the process of dealing with the requests for assistance.
PM Nagamutu says he is unaware if any request was denied.
I can say this, though, that Guyana has not been deemed disqualified from receiving any assistance from anywhere.
The Prime Minister informed that Guyana is also pursuing assistance from India through the Indian Grant to Caribbean countries and has approached the People's Republic of China as well. Remember to continue practicing social distancing. For InfoHub, Stacey Carmichael.
More COVID news. Close to 1,800 households have received relief hampers from the Civil Defense Commission as part of ongoing efforts to mitigate the impacts of the measures implemented to prevent the spread of the coronavirus. Details in this story. Since the distribution commenced on April 5, 2020, 25 communities in regions 3, 4, 5, 6, and 10 have received the hampers, which contain a month's supply of food items. The latest distribution exercise was conducted in the East Berbice quarantine region. Region 6 Councillor Shirley Scott commended the Commission for the initiative.
I have been following what is happening in the country at large, and I must applaud the CDC for this effort and thoughtfulness, because in a time of uncertainty and unemployment and so many things happening in the country because of the COVID-19 pandemic, I really celebrate this initiative because it is bringing much relief to the residents.
In a release, Senior Response Officer of the CDC, Captain Salam October, said that the success of this exercise so far has been achieved through CDC's careful coordination through the National Emergency Operations Center with local non-governmental organizations, governmental agencies, regional democratic councils, community liaisons, and some members of the private sector. Quote, "The CDC recognizes that for the entire nation to benefit and for efforts to be maximized requires broad-based interventions by as many organizations and entities as possible. At this juncture, the CDC recognizes that similar initiatives to provide relief to citizens are being implemented by various organizations, including NGOs, international and local agencies, and individuals. As the National Authority for Disaster Risk Management, we are heartened by these wide-ranging, noble, and humanitarian-driven acts that no doubt will rebound to increase food security for many. It was noted that while there is the belief that the pace of the Commission's distribution exercise could be increased, persons must be cognizant of the fact that the Commission had the foresight to procure supplies before the situation drastically changed from then to now. In light of the challenges, the CDC, in collaboration with key stakeholders, conducted assessments and analysis, and the neediest and vulnerable communities were the recipients of the first batch of supplies. Further, distribution and procurement plans have already been developed to direct the process on the availability of the required resources. The CDC welcomes all donations and reminds citizens who wish to make a contribution that they can do so at its head office at Thomas Lands between 9 hours and 15 hours daily, while cash and checks can be deposited to its Republic Bank account 963565199938. Guyana is expected to see an overall 51.7% economic growth for this year, with further projections over the next 2 years. This was reported by the World Bank on Sunday. In a semi-annual report of the Latin America and Caribbean region titled "The Economy in the Time of COVID-19," the International Financial Institution projects a 51.7% GDP growth for Guyana for this year, while 2021 and 2022 will see an 8.7% and 2.6% GDP growth, respectively. The report stated that Guyana's economy has expanded by some 4.7% in 2019, with anticipated oil revenues spurring expansion in non-traded sectors. It is said oil production is projected to boost the country's GDP growth to an unprecedented level this year. Read more of this story on our website at dpi.gov.gy. More news after this short break. Thanks for staying with us. The country's COVID-19 hospital is soon to be completed, while more quarantine facilities are being prepared. Senior Communications Officer Delicia Haynes tells us more.
The COVID-19 hospital, formerly the Ocean View International Hotel, will be up and running within a few months as rehabilitative works are ongoing. The facility is expected to accommodate between 150 to 300 patients. The facility is among a number of those that is listed for the housing of COVID-19 related patients, as government strives to achieve the capacity to house at least 1,000 patients. Meanwhile, the Cliff Anderson Sports Hall has been transformed into a quarantine facility as of Sunday, catering for a possible 200-plus persons requiring quarantine after suspected exposure to the coronavirus. National quarantine and isolation facilities have already been established at the West Demerara Regional Hospital, the Diamond Diagnostic Center, the Georgetown Public Hospital Corporation, the Madawini Youth Center, and the National Gymnasium. Consideration is also being given to transforming the Guyana Broadcasting Corporation GBC building on High Street into a similar COVID-19 facility. For InfoHub, Delicia Haynes.
Still in the health sector, several riverine communities across Guyana are set to benefit from increased access to health services with the provision of boats, and in Region 10, another river ambulance. Here again is Delicia Haynes.
The river ambulance for Region 10 was supplied by Metatron and is valued at $17 million. Regional Health Officer Dr. Pansy Armstrong spoke of how this will boost health services.
It will be used in the Demerara River for healthcare delivery, as well as to transport medical emergencies to hospital. It will be stationed in the Malali area, which is the furthest point in the Demerara River. And therefore, with the help of this boat, we will be able to make healthcare more accessible.
This is the second river ambulance for the region. Meanwhile, 5 boats have been procured for other areas to aid in the delivery of health services. 2 have been handed over to Region 7, 1 is for Region 3, and the other 2 will be designated to other riverine communities in need of the service. John Adams, technical advisor to the Minister of Public Health, explains.
These 2 boats are being handed over to Region number 7 to be used as river ambulances for the upper and middle Mazaroni. And it's just another way in the Ministry of Health ensuring that health care is being accessible in every region and in all parts of Guyana.
The total cost of the 5 boats is approximately $2.6 million and was supplied by Ivor Allen. The vessels are part of an initiative which saw several boats handed over within 2 years to regions across the country. For InfoHub, Delicia Haynes.
Let's tell you now that contrary to what is being rumored, viruses cannot travel on radio waves or mobile networks. COVID-19 is spreading in many countries that do not have 5G mobile networks. COVID-19 is spread through respiratory droplets when an infected person coughs, sneezes, or speaks. People can also be infected by touching a contaminated surface and then their eyes, mouth, or nose. Remember to do your part to ensure you do not put yourself at risk during this time. If you have a cough, fever, and difficulty breathing, seek medical care early, but call the hotline first. That's all for today. Connect with us on all our social media platforms, including WhatsApp, Facebook, YouTube, and Instagram, as we bring you the latest and important news related to COVID-19 and much more. Also, subscribe to our website, dpi.gov.gy. Your birth report is up next. Stay safe and goodbye for now.